The American Academy of Pediatrics Council of Sports Medicine and Fitness felt that it was important that we create and put out pediatric and adolescent specific guidelines for sports-related concussions because there were none that were existing at this time. The guidelines that are out there were put out for the general athlete of all ages, but we know that the pediatric and adolescent athlete is unique in many aspects, especially when it comes to concussions. The younger athlete is at risk for special problems, one being second impact syndrome, which occurs when an athlete has a concussion and the brain has not completely healed and they get another brain injury, which can then cause brain swelling and cause either permanent brain damage or even death. They're also at risk for post-concussion syndrome when their symptoms last for weeks to months to even years. We also know that the pediatric and adolescent athlete takes longer to recover. It's a more prolonged recovery than your more mature adult athlete. The main emphasis is on education of the parents, of the athlete, of the coaches. It's on recognition of what a concussion is and taking the athlete out of danger by taking them out of the practice, and then proper treatment. And again, the unique things with treating the pediatric and adolescent athlete is adjusting their school schedule, adjusting their sleep schedule, and adjusting their exercise level. A concussion is a brain injury, and your child only has one brain, and once there's permanent brain damage, it's permanent and it can't necessarily be fixed. It's unlike tearing your ACL that can be reconstructed. So it's important to take concussions very seriously, and it's not just a ding to the brain or just a bump or just a bruise, and that we need to recognize it right away. We need to treat it appropriately because there can be long-term consequences.